Hello, I'm Leanne Kiefer. I'm a dental hygienist, and I'm also Director of Education for Crosstex International. We've been discussing the various steps of the instrument process. Now we've gone through the transport from the contaminated instrument to the sterilization area. We've completed cleaning, placed the instruments into a pouch, and it's then been sterilized. We've removed the instruments from the sterilizer, and the first thing that we want to look at is to make sure that we have achieved sterilization. So we're going to look at the instrument pouches. If the appropriate steam sterilization parameters have been met, you will see a dynamic color change in that multi-parameter indicator from pink to a very dark brown, both on the internal and the external part of the pouch. The opposite side of the pouch has remained green. Again, this is the chemical indicator. The next thing that we have to think about is the last part of the process, quality assurance. Quality assurance starts from the moment that we remove the sterilized instruments from the sterilizer. The pouch should only be handled 3 or 4 times before it's actually going to be used in a clinical situation. The first time being when we remove the instrument pouch from the sterilizer, and then it's important, how do we transport from the sterilization area back into the treatment room? When we place them into the tote, it's important that we pay attention to some of the information that we wrote on the sterilization pouch. Primarily, let's take a look at the date that's written on there. Instruments should be on a rotated basis, so the newest instruments would actually be placed to the back, and then the next instrument to be used would be the one in the front. The concept can be called first in, first out. When the instruments are brought into the treatment room, it's important to not only look at the date, to make sure that the chemical indicators have in fact changed. The other thing that we want to do is we want to look at the integrity of the pouch itself. We want to make sure that there is no punctures or pops on the side of the rails or at the top or at the bottom. We want to make sure that the plastic has not been cracked or compromised. The last thing that we're going to look at is also going to be to turn over and look at the back of the pouch, because we want to make sure that there's been no puncture or tear in the paper. We do have an example of one, that there is a small paper tear at the very top. This particular pouch should go back to the sterilization area. The instrument should be re-cleaned, repackaged in a SureCheck pouch, and reprocessed through an entire sterilization cycle before being placed into a storage area. Now, what does the date also mean besides first in and first out? There's a concept that we call event-related versus date-related. As long as the pouch has not been compromised and you're using first in, first out, that's going to be event-related sterility. What could compromise it besides an instrument puncturing the package? I've seen practices that maybe use a large plastic tote and they all get put in, and different clinicians come in and they pick out the ones that they're going to want to use for their room, but they're moving against other instruments and packages. So it's better to store it in something that the packages are not going to move in the tote. So make sure it's size appropriate. The other thing I would suggest is when we have this tote, we don't want to keep them on our clinical counters, because the CDC does recommend that we keep our counters in environmental space as clean as possible. Therefore, make sure that the tote sizes you choose are going to fit into a cabinet, a closed cabinet door. A lot of practices, they'll put them into drawers, just the packages themselves. But when you think about it, each time you're opening and closing that door and these packages are sliding maybe against the wood on the drawer, you're compromising that package. So it's better to have them in a tote and have them inside a closed cabinet.